why do I remember I tried like
I know.
with
Some people, the
migraines,
problem is there are some people we don't know how to deal with that. I mean, there are people who cannot tolerate it, and if they're getting some people feel like they're going to get vertigo, dizzy. You know, they get too dizzy, they can't handle it. So now I am trying some different, and we might want to maybe take another run at it. I don't know what I'm doing now, but this is important here. So reduce weight carried in front of your body. No slouching in your chair. No sleeping on a big puff of pillow. No bending or lifting improperly without your legs. And these are just the kind of the concepts, because if it's starting to deteriorate here, these are the things that we want to see happen. Reduce sitting. It increases pressure on the last three lumbar discs 10 times. So the difference between you who are sitting under your desk, you're sitting in a chair, versus me standing, there's a big difference in how much pressure is on our discs.
So you're better off standing than sitting?
But far better standing than sitting.
Oh, is that right?
Yeah. Although, what you'll notice about what I've done here, do you notice I have a sitting desk, a sitting chair there, and I have a standing station here. When I'm back there with you, what do? I sit down. Do you notice that? When I'm there, I'll sit. When I'm checking your range of motion, I'll sit on that little bit. So it's all I'm trying to pace my body and alternate with the position. So it's not one is better than the other. We want to pace it. So function determines structure. Never take posture for granted. Rebuild your joints using them properly, and observable changes will occur in your structure. And I can see with my own finger, I'm seeing a change, and I can see my finger's right here, which is kind of I will use it every day, and I'm really aware of it. So think about your needs. Make sure the nerve flow is really the primary thing for you. And this is what I want to end with tonight. And I know I've kept you a little bit long, and I apologize for that. But tonight, this is what I've been thinking about. What are we going to end with tonight? I want to tell this story. There was a study that was done, and if any of you are really technical and you would like the data, Nancy, do I have on my printer? I have some articles there. Years ago, a study was done on some patients of a chiropractic clinic. And what they did is they analyzed the shape of their curve, and they analyzed the number of bone spurs that were in their neck. All right. And so what I have, and I'll let you have this now, and you can take this home with you. The first chart that I have up there is the very top chart here. What they decided to do is analyze these x-rays. And what they were looking for is the amount of arthritis in the neck. And was there a connection between the shape of the neck and how many bone spurs that formed, and if so, how bad were they and where were they? All right? And it brings up some really interesting data. All right. So what do you notice? That first one, look at the ages and the colors of those things. There were actually some people who were less than 10 years of age who had bone spurs already in their neck. You see how C2, C3, C4, C5, so on that top chart there, where are most of the spurs? What number of bone? You see that at C5? Mm-hmm. And you see how the color is, and you'll need to take a little bit of time and look this over, but basically each one of those colors represents how old the people were. That yellow, which is the top one, do you realize that's the people who were between 21 and 30 years of age? They had the highest number of people with bone spurs there. All right. Now so tonight, this is gonna change your thinking, okay? Because what are we expecting? We're expecting to see that the people who have more spurs and worse spurs are going to be the young people or the old people, right? And if that were true, all these charts would have a completely different shape to them. They would be small when we're 10, 20, 30, 40. And as we're at 40 and 50, we would see this big up curve like that, wouldn't we?
Right.
We're not seeing that.
Not seeing that.
And then we go down to the next one. And it's the number of spurs by location. Okay. Well, the places C5 and 6 are the most prevalent. Not up at C2 or 3 or 7. It's C5, 6. Why there? Well, it's actually below the halfway.
Yeah, it is.
But remember, when we get these car accidents and our neck curve changes, where does the curve change? Down low. And so, from a chiropractic standpoint, the reason these spurs form is these patients have curve problems. And a lot of them have just a straightening of the curve, but a lot of them have terrible reversals and things like that. But the vast majority of spurs form at C5. Okay. Now, look at this lowest one. you a question. If all of these people, these young people here who had these spurs in their 20s and 30s, I mean, look at this. How many of these people had spurs? Wow, it's high. Whoa. Wait a minute here. As you get 50, 60, 61, 70, 71, 80, 81, 90, hardly any of the 80 and 90-year-olds had bone spurs.
Huh. Why is that, Dr. Day?
Because there is no more bone building material.
Round off?
What's that?
Round off?
No.
Or sitting on the computer.
No, they don't. They don't get better and better. No, they get bigger and bigger. But what happens to the people who have big bone spurs here?
Oh, by the time they're 50 and 60, if they last that long.
Art has the answer. They die.
Oh, that's right.
When I look at your X-ray, right, you understand the odds of you living to be 80 and 90 or 100 if you have a lot of bone spur formation in your neck is grim. Now, it doesn't mean it can't happen, but you understand when I talk about arthritis, and when I think about arthritis, the stuff that keeps me awake at night is not whether you have a sore ankle or knee or hip or something like that. I worry about, can we keep you alive? Can we keep this neck functioning? Because through that neck is the lifeline, all the nerves to your whole body. And if that gets choked off, if it happens to choke off a vital nerve, you're going to die, and whether it's a pancreatic cancer or whether it's a lung problem like emphysema or whatever, a lung cancer, whatever, something is going to get you because somehow that nerve system was starting to become sluggish into a vital area. And then that vital area is going to start to fail. And you'll die of a heart disease of some sort, or you'll die of something. But you're going to end up dying because the nerve flow itself was not able to pass through it well. So tonight, I want you thinking about what we taught you about the foods and things like that, and I want you then to think about your life and say, this is a big topic, but what are the things that I can do today? And then 3 months from now, what will I do? And then 6 months from now and a year from now. But I want this all to be colored with this, and think about your own neck and say, wow, I need to make sure I bend this neck back. I got to figure out a way to keep my body functioning. I want to keep everything working as well as I possibly can to keep my nerve system flowing freely. Because if I don't do that, it's going to collapse and it's going to ultimately cause me to die. And I will not be one of the people who are going to live to be 80 and 90 years old. You see. So,
Not today. If I hadn't started coming to you over 20-some years ago, I wouldn't be here today.
well, isn't that something?
Honest to God, I know I wouldn't be here. Well, thank you.
Thank you. And that's, you understand, this is what inspires me, right? Is really just keeping people alive who might otherwise have gone down a pathway that would have been very, very destructive for their body. So as you're talking to your friends about arthritis, don't just talk about the soreness in the joints and the pain and that sort of thing. Talk about the likelihood of them living or dying because they have arthritis. Yeah.
I'm not even sure what arthritis is.
Yeah. Arthritis is basically an inflammation of the joint. All right. Caused typically, most commonly, by abnormal forces pounding and smashing that joint, and then the body dumps calcium into that joint to shore itself up and say, and we call that, so that's the arthritis. Arth is joint, itis is inflammation.
So are you saying if you work too much of your hands, Dr. Dave, is that how you get arthritis too?
So here's
the
the question.
Painting? Okay, I get a lot
Yeah.
of painting, Dr.
The
Dave.
more, when you do a lot of repetitive tasks, just like Dave was talking about the guitar players in the carpal tunnel, or the musicians, the violin players, if you use a part of your body repetitively and consistently, you are at increased vulnerability to developing arthritis or tendonitis, those types of things. Doesn't mean you can't do it? No, but it means that you have to come up with a strategy where you're working and moving your fingers that's different from what you do in your life, right? So that's where I'm trying to take you is say, start thinking about your body and why it's doing what it's doing and how do we undo it. You see, that's what we do. And that's because otherwise it's going to be very discouraging, right? And that's where the medical system, it discourages everybody from trying to do anything. I'm trying to re-engage you in this process. What are the things that you can do to rebuild your body? And there's a lot of things. A lot of people don't realize it or they're not doing it. So thank you for coming tonight. Have a wonderful evening, and do think about this because it's a really important topic, all right? Thank you so much.
Thank you.